I am scanning the room. For any cheat sheets. Okay. Okay, so the first 4 things I'm going to do is check my patient chart, provide for privacy, use 2 patient identifiers, and wash my hands. So hello, how are you? My name is Shantese. I'm going to be your student nurse today. I'm going to have you verify your name and date of birth, and I'm just going to check the tag.
Paul Powell, 8/6/1991.
Okay, and what brings you in today?
Checkup.
Okay, and are you in any pain?
No.
Okay, so if the patient was in any pain, I would use the PQRST scale. So I am now going to inform my patient what I'm going to do. I am going to conduct a lung and cardiac assessment. So I'm going to start by inspecting my patient. I'm looking at the patient's skin on his face, his neck, his chest, his abdomen, his upper extremities, lower extremities, and his posterior chest and his back. His skin is clear, no abrasions, no lesions, no wounds. The patient does have tattoos on his chest and upper extremities. He does have hair on his chest, which is evenly distributed and normal for his ethnicity. The patient's skin on his upper extremities is warm to the touch. On his lower extremities is warm to the touch. I am now going to move to the neck, so I'm going to collect some subjective data. So do you have any neck pain?
No.
Any difficulty swallowing?
No.
Any trauma or injury to your neck?
No.
Okay, and before I forget, I'm looking at the patient facial expression, which is relaxed, and no, the patient does not appear to be in respiratory distress, and no use of accessory muscles. So I am now going to do the carotid arteries, which I can only check one at a time. So I'm going to start checking the carotid arteries. They sound like... Okay. So the carotid arteries are a 2+ equal bilateral. I am now going to listen in 3 areas. I'm going to start by under the jaw, and then I'm going to go to the middle of the neck, and I'm going to go to the base of the neck. I'm going to start here. Okay, so no bruits noted. I am now going to check for jugular distension when I have the patient lay flat down. So I'm going to have you lay this way with your head that way. Okay, and I'm going to have you turn your head to the side. Okay. So I can see the patient jugular vein, which is filled as it should be, but no enlargements or bulges noted. And I will have the patient sit at a 45-degree angle. But since I don't have a hospital bed, I'm just going to have the patient sit straight back up, which would be approximately 90 degrees. But we're just going to pretend that it's a 45-degree angle. So I'm going to have you sit back up. And the vein did flatten as it should. And I'm going to have you turn back around into your spot that you was in. So I'm now going to move to the chest, and I'm going to start with some subjective data. So, do you have any difficulty breathing?
No.
Any shortness of breath?
No.
Any family history of asthma?
No.
Okay. So I'm looking at the patient's chest. The chest is symmetrical, as it should be. I am going to let me think. Okay, so I am going to locate the PMI, which is going to be mid-clavicular line, 5th intercostal space, and it's going to be like at the tip of the apex. I'm going to palpate there, and I'm just feeling for any heaves or lifts. Oh, no heaves or lifts noted. I am now going to check, I'm going to do the ape to man, so I'm going to check my cardiac areas. So I'm going to start by auscultating the aortic, which is second intercostal space, right sternum border. And then I'm going to move over to pulmonic, which is left sternum border, second intercostal space. And I'm going to move to Erb's point, which is left sternum border, third intercostal space. I'm going to move to tricuspid, which is left sternum border, fifth intercostal space. And then I'm going to move to mitral, which is mid-clavicular line. Okay, so I did hear the S1 and S2 sounds. I didn't hear any additional sounds or any heart murmurs. So I'm now going to do the lung fields, and I'm going to start by auscultating the lung fields. So I'm going to start with the apices, which is up at the top. And I'm going to have the patient take a deep breath in and out before I move to the next area. So I'm just going to have you take a deep breath in and out each time. Okay, so all the lung fields were present and clear. No rhonchi or crackles noted. I am now going to percuss the lung field starting at the second intercostal space, and I'm going to move down and compare both sides bilaterally. Okay, so the sounds were resonance as it should be. No abnormal findings there. I am now going to measure the patient AP diameter by coming to the side. You kind of sit up some. So the patient AP diameter is about a 1 to 2 ratio. I don't see no barrel chest or any abnormalities there. So I am now going to have you try to turn around so the camera can see your back. So I'm now going to do the posterior side of the chest. So I'm looking at the chest. The chest is symmetrical. The color is evenly distributed as it should be. The skin is warm to touch. And I'm going to check for chest expansion by placing my hands at T10 and having the patient take a deep breath. So now you take a deep breath. Okay, deep breath in. Okay. So my thumbs did move apart symmetrically as it should. I am going to perform tactile fremitus, where I'm going to place the palm of my hand into the patient's chest in different areas while he repeats the number 99. And I'm just checking for vibrations on each side to make sure that it's equal bilateral. So as I put my hand on your chest like this, I'm going to have you repeat the number 99.
99. 99. 99.
Okay, so the vibrations was equal bilateral as it should be. The vibrations diminished as I went further down as it should be, and no crepitus noted. So I am now going to also take the lung fields. I know that this area here is C7, T1. I know under the scapula is T8, and I'm going to listen all the way down to T10. I'm not going to go to T11 or T12 because that's the floating ribs. I don't need to go that far. So I'm just going to compare each side by going straight down or across. Okay, so I'm going to have you take a deep breath in and out. And I'm doing the JL technique, so I'm going to avoid the scapula. Okay, so all lung sounds were clear and present, no rhonchi or crackling noted. I am now going to percuss my lung fields. Okay, so all sounds were resonance as it should be. No abnormalities there. And I think I am done with the posterior chest. I'm happy to sit back on the couch for me. So I am now going to do the patient upper extremities. So I am looking at the patient's arms, and they are equal bilateral. I'm going to ask the patient some questions about his extremities. So, do you have any difficulty walking?
No.
Do you have a family history of arthritis?
No.
Okay, any pain in your joints?
No.
Okay, so the skin is evenly distributed. I already palpated the skin, which was warm to the touch. I'm going to check the patient capillary refill, so I'm going to see your hands here, and I'm just going to do 3 fingers on both hands. Okay, and that one. Okay, so capillary refill is less than 3 seconds. I'm going to check for edema by pushing against the bony prominence of the patient arm. I'm just gonna push down. No edema noted. I am going to check my pulses, so I'm gonna start with the radial pulse. Okay, so the radial pulse is a 2+ equal bilateral. I'm going to check the brachial pulse. Okay, so the brachial pulse is a 2+ equal bilateral. I am going to check for upper extremity strength, so I'm going to have you grab my fingers and pull against me and then push against me. Okay, so no weaknesses noted. Oh, my thing cam button. I am now going to do the lower extremity, so I'm going to have you actually lay this way. Okay, so I am looking at the patient's legs. The legs are equal bilateral. I'm going to check for edema in the legs by pushing against bony prominence and no pinching noted. I am now going to do capillary refill in the patient's toes. I'm going to do the 3 toes in the middle on each foot. And this one. Okay, so the capillary refill is less than 3 seconds. I am going to do the dorsalis medius pulse, which is in the middle of the foot. Okay, so the dorsalis medius pulse is a 2+ equal bilateral. I'm going to check the posterior tibial pulse, which is on the inside of the foot behind these little nodules or whatever you would call it. And that is a 2+ equal bilateral on each side. And then lastly, I'm going to check the popliteal pulse, which is behind the knee. Okay, so that is also a 2+ equal bilateral. And then I'm going to check the patient perception in his foot by using an object. So what I'm gonna have you do is close your eyes. I would normally have something that's soft, dull, and sharp, but I only have soft and sharp. So you're gonna just tell me if you feel a soft object or a soft object or a sharp object. Okay, so close your eyes. Hold your foot up here, kinda.
Soft. Sharp.
Okay, so the perception is normal, as it should be. And I think I completed everything. I don't think I'm missing anything, I'm not sure. But if this was the end of my assessment, I would make sure the patient has non-slip socks on. The bed rails is up. His call light near him and his table by his bedside. And I think that completes my video.